Welcome to your final review for ST Theory 1. You have spent the past several weeks building foundational knowledge. This session is designed to organize that knowledge, not reteach it. This review will focus on core principles that repeatedly appear in our practice. Everything from infection control, environmental safety, department structure, sterile technique, professional standards, or traffic patterns and role responsibilities. The cumulative exam will assess your ability to recognize principles, differentiate correct from incorrect practice, and apply foundational standards to clinical situations. This review is not a replacement for studying. It's a framework to help you identify what you understand clearly, what you may need to revisit, or where confusion may still exist. Now, advancement to Module 3 requires two things: a passing score on the final exam and a minimum 75% course average. It's not about pressure, it's about readiness. Module 3 builds on this foundation. If the foundation is weak, the structure above will not hold. So I want you to use this review actively. Pause when you need, write down responses before we kind of go over them. Revisit your notes and your textbook when needed. Passive listening is not going to be what's going to help prepare you. Now, our goal this week is not just to review, it's readiness. So, review looks backward, readiness looks forward. The first objective is to clearly clarify the path, how the exam is structured, what types of questions to expect, how foundational principles are tested, and what advancement actually requires. We're going to eliminate the guesswork. There should be no surprises. The second objective is connection. Surgical practice is not isolated facts. Infection control affects environmental safety. Traffic patterns influence sterile field integrity. And professional behavior impacts patient outcomes. The exam will assess whether you can recognize how principles interact, not just define them. And third, we build your confidence. Confidence does not just come from hoping. It comes from preparation, from repetition, from identifying weaknesses, and correcting misunderstanding. Confidence in ST is built through clarity, structure, and discipline. This review session is designed to move you from passive recognition to active understanding. Now, before we move on, I want you to ask yourself, where do I feel strongest? Where do I hesitate? What concept still feels unclear? Write that down. Let's take a clear look at the structure of your final exam. The exam consists of 60 multiple choice questions. Each question is designed to assess recognition and understanding of foundational principles covered throughout this course. You have 45 minutes. That averages to about 45 seconds per question. Some questions will take less time. A few may require closer reading, so try to pace yourself. If you do not know an answer immediately, mark it, move forward, and return if time allows. This exam is cumulative. It covers all the major concepts, that we went over in this course, not just recent material. So that means we're talking about surgical department objectives, infection control principles, environmental safety, traffic patterns, sterile technique, professional responsibilities. A score of 75% or higher is required to pass the course. Both the final exam and your overall course average must meet that standard for advancement to Module 3. This is not a speed test. It is not a memory contest. It is an assessment of whether you can consistently recognize correct surgical practice. Before we move into the review content, I want you to consider, are you studying for familiarity or are you studying for accuracy? The final exam is not simply measuring recall. It's measuring professional thinking. You're being asked to think like an ST in formation. You will encounter scenarios, not just definitions, situations. In those moments, your task is to apply principles of safety, ethics, and patient care to what is happening. Ask yourself, what risk is present? What standard applies? What protects the patient? Then you're going to prioritize your actions. Some questions will require you to determine the first or most critical step. This is especially important in emergency or time-sensitive scenarios. Professional readiness requires understanding sequence. What must happen first? What cannot be skipped? And what creates the safest progression? Then we identify principles. You must also recognize the underlying rule guiding a decision. Is this about asepsis? Informed consent? Scope of practice? Or is it about environmental control? Correct answers are rooted in principle, not opinion. We cannot forget to differentiate roles. Another key area is role differentiation. You must clearly understand the responsibilities of sterile versus non-sterile team members. Confusion in role boundaries create risk in the operating room. Now, before moving on, pause, write down one concept that you understand clearly. Then write down one concept that still feels uncertain. Clarity begins with honest self-assessment. Now we move from structure to substance. These are your pillars. If your understanding here is strong in these 5 pillars, you are positioned to succeed. We start with patient-centered care. This includes psychological needs, Maslow's hierarchy, special populations, and informed consent. These are not abstract ideas. They shape how we communicate, how we prepare patients, and how we advocate for safety. Ask yourself, can I recognize when patients' rights are at risk? Can I identify when informed consent is incomplete? Can I connect psychological safety to, let's say, surgical preparation? Safety in the OR environment is second. We look at things like electrical hazards, radiation safety, laser precautions, humidity and ventilation control, fire prevention. These are system level safeguards. Failure in this area creates immediate risk. Can you identify environmental threats before they escalate? Now to the third, asepsis and sterile technique. the sterile field. We look at skin preparation, decontamination, sterilization. This is the backbone of surgical infection prevention. You must distinguish between what maintains sterility and what compromises it. The fourth is emergency and disaster response, cardiac arrest protocols, triage, all hazard events. This area tests prioritization. In crisis situations, what happens first? Who responds? What sequence protects life? And finally, professional and legal standards, scope of practice, ethics, credentialing, HIPAA, malpractice. These define boundaries. Professional identity is not just a skill. It is compliance with standards. So when you study, do not move randomly through slides. Organize your review by pillars. Ask yourself, within this pillar, what are the core rules? What are the common violations? What is the patient risk if ignored? So let's connect the dots. Let's walk through the patient's pre-operative journey. Before the first incision is ever made, multiple standards are already in motion. This is how the exam will think, not isolated facts, but connected processes. When the patient arrives, what is happening beyond check-in? Are there cultural considerations? Is there a language barrier? Is spiritual support requested? These are elements of patient-centered care. Legal and ethical standards begin here, not in the operating room. What risk is created if psychological or communication needs are ignored? Then we're at the pre-op. Consent must be verified. Is it signed? Is it complete? Does the patient demonstrate understanding? Sedation status must be appropriate. Identification must be confirmed. This is legal compliance intersecting with patient safety. Failure here does not just delay surgery, it creates legal and ethical liability. Now we're entering into the operating room. As the patient enters the OR, environmental safety becomes primary. Is positive pressure airflow functioning? Are humidity levels within range? Is the environment prepared? These are not background details. They are infection control measures. Environmental control is part of aseptic practice. Now, once on the operating room bed, positioning safety becomes critical. Is proper grounding pad placement ensured? Are pressure points protected? Is alignment maintained? Here we see the intersection of safety, anatomy, and professional responsibility. Notice how no single pillar stands alone. Legal standards, environmental safety, asepsis, patient-centered care, they are layered. Now, I want you to write down which pillar is most active in each phase of this journey. Before an incision is ever made, dozens of standards have already been applied. The exam will expect you to recognize them. Now, this is not a viewing moment. This is a thinking moment. without your notes. List the 3 most critical actions to take immediately following a needle stick. Write them down. Now, do not rely on recognition. This is where you rely on recall. Ask yourself, why is immediate reporting required? What is the rationale behind the protocol? This is not simply about policy. It's about exposure control, documentation, baseline testing, chain of responsibility. Now, if you struggle to recall all 3 actions in sequence, that is a signal. Review is required. In surgical practice, hesitation after exposure creates risk. Protocols exist to protect both the patient and the surgical team. This exam will expect you to know not just the steps, but why those steps exist. Now we shift into principle recognition. The exam will often present a situation, and your task is to determine the governing rule. Let's walk through each scenario. We start here. A non-English speaking patient is handed a consent written in English. What principle is at stake? This is not simply about paperwork. It's about understanding. It is about patient rights. It is about valid authorization. If comprehension is not present, consent is not valid. Scenario 2. A minor requires a life-saving blood transfusion, but their family's religion forbids it. What principle governs this situation? This scenario involves autonomy, legal authority, beneficence. It also involves emergency exception standards. Notice how ethics and law intersect. And then scenario 3. A surgeon asks the surgical tech to perform a task outside the official scope of practice. What principle applies? This is not about hierarchy. It is about scope, licensure, professional boundaries. Following an inappropriate directive does not remove accountability. In each of these scenarios, the correct answer is rooted in principle, not personality, not pressure, not assumption. You must identify the governing rule. Now pause this recording. For each scenario, write the principle that applies and briefly explain why. Professional maturity is demonstrated when you recognize the rule before reacting to the situation. Now let's step into the operating room environment. Imagine you're standing in this space before the patient enters. What should you be assessing? You have positive airflow. Why does that matter? Positive pressure prevents contaminated air from flowing into the sterile environment. Air moves out, not in. This is infection control at a systems level. Let's look at humidity control. We see 20 to 60%. But why this range? Too low increases static electricity and fire risk. Too high increase microbial growth. Environmental control is both infection prevention and hazard prevention. Let's come up here to specialized electrical receptacles, or those red outlets. What hazard are they designed to prevent? Remember that these support critical equipment and reduce overload risk. Electrical failure in the operating room is not an inconvenience. It's a patient safety threat. And down here, right, we have our computer documentation. But how does this support patient safety and legal records? Remember, accurate documentation protects continuity of care. It also provides legal accountability. Incomplete documentation creates vulnerability. Notice that none of these are background details. Each environmental element serves a safety function. The exam may not ask, what is the humidity range? It may present a scenario where humidity is out of range and ask you to identify the risk. Pause here. List 2 environmental controls and the specific risk each one prevents. In surgical practice, environment is not passive, it's protective. Now we move into role differentiation. Again, this is not memorization. This is boundary recognition. In your notes, create a simple 2-column table. One column, you have your sterile team member. In the second column, you have your non-sterile team member. Place each listed responsibility in the correct column. Do not rush, because accuracy does matter. Now, as you categorize, I want you to consider, is this task performed within the sterile field? Does it require maintaining sterility? Or does it involve a coordination, retrieval, or documentation outside of the sterile field? Think in terms of environment, position. Where is the individual standing? What are they touching? What responsibility are they protecting? Confusion between sterile and non-sterile responsibilities does create risk. In the operating room, role clarity actually protects the field. Scope of responsibility is not interchangeable. Again, pause the recording here. Place each role in the appropriate column before continuing. Now, preparation is not about cramming. It's about strategy. If you study without structure, you create fatigue. If you study with structure, you build retention. So pace yourself. Do not attempt to review everything in one sitting. Choose one pillar each day. Rotate through patient-centered care, safety, asepsis, emergency response, and professional standards. Short, focused review sessions are more effective than marathon studying. Second, explain concepts out loud in your own words. If you cannot explain why a principle matters for patient safety, your understanding may not be complete. Ask yourself, why does this rule exist? What risk does it prevent? Connect the ideas. Do not isolate topics. How does Maslow's hierarchy relate to informed consent? How does environmental safety connect to asepsis? How does the scope of practice intersect with legal liability? The exam rewards integration. Fourth, stimulate applications. Work through CST style practice questions. Focus on the rationale behind each answer, not just the letter selected. If you choose the correct answer but cannot explain why, are you fully prepared? And smart preparation builds confidence. Confidence reduces hesitation. Hesitation in surgical environment creates risk. So, study with intention. You have completed Module 2. You have studied surgical department structure, infection control systems, environmental safeguards, professional boundaries, and patient-centered care. These are foundational pillars of surgical practice. This exam is not about perfection. It's about consistency and principle-based thinking. Read carefully. Identify the governing standard. Eliminate what compromises safety and choose what protects the patient. You have a couple additional resources that are available for you. You have your Kahoot and your Quizlet link. Use them intentionally. I want you to focus on rationale, not just recognition. Keep in mind that rehearsal builds clarity. Clarity builds confidence. Now, we have a couple of discussion forum questions that we're all going to answer, okay? From Chapter 2, Communication and Teamwork. How does effective communication directly influence patient safety, particularly in high-stressed surgical environments? From Chapter 14, which was Death and Dying. How do we, as surgical techs, balance technical responsibilities with dignity, compassion, and respect for patients and families at the end of life? And from Chapter 36, Disaster Preparedness and Response. During a mass casualty event, what role do we as the CST play in maintaining organization, ethical standards, and patient prioritization? When you're writing your responses, I want you to think through the principles behind them. You have progressed significantly since week 1. Growth in our profession requires discipline, accountability, and resilience. And you have demonstrated all 3. You have chose to invest in your development. Now demonstrate that investment on that final exam. Stay steady. Proceed with focus and demonstrate that readiness. With that, if there is anything that comes up, if you have any questions, please let me know. Remember to set yourself up for success. All items are due by Saturday, 11:59 Pacific Standard Time. So do not wait till the last moment. If something does happen, again, send me a Moodle, send me an email, let me know. You all have a wonderful rest of your evening. Enjoy your break, and I look forward to seeing everyone in Module 3. Good night, everyone.